This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning on Columbus Concerns. The city of Columbus and the state of Ohio are set to get back to work. In fact, the governor and the mayor have outlined a plan to slowly start reopening businesses during the COVID-19 pandemic. And this week, the mayor of Columbus, along with his health commissioner, Dr. Mysheika Roberts, held a press conference to talk about how Columbus will be opening up in stages. So this morning on Columbus Concerns, the mayor of Columbus, Andrew Ginther, and the Columbus health commissioner, Dr. Mysheika Roberts.
We know our community is suffering greatly from COVID-19, physically, emotionally, financially. 1,529 residents in Columbus have been infected. 38 have died. 12% of our neighbors are unemployed, and many are facing food and housing insecurities. But thanks to the leadership and partnership of Governor DeWine and the steadfast effort of our neighbors, we have significantly reduced the rate of infection, spared our hospitals and healthcare systems from being overwhelmed, and we've helped to save lives. But the virus is still among us, and efforts to reopen must be based on the best science available. It is not business as usual, but I support the governor's thoughtful, measured approach to reopening the economy slowly and safely. We've expressed 5 areas of need to Governor DeWine before we contemplate reopening, and we've made great progress. We asked about greater flexibility and expanded access to testing. And just since our engagement, the number of tests statewide are going from 3,700 to 7,200 a day, with plans to ramp up to 15,000 and ultimately 22,000 tests a day just in the next couple of weeks. We asked for increased testing supplies and kits. Just last week, 1,000 kits were brought to Columbus Public Health for Dr. Roberts and her team to use with partners here in the community. We've asked for the encouraging and recommendations for all residents to wear facial coverings in public, because we know how important that is to protecting ourselves and our neighbors, particularly the employees on the front lines in our grocery stores, our pharmacies. We wanted clear, consistent guidance on mass gatherings throughout the state, and the governor has assured us that they will remain in place for the foreseeable future. We also asked for clear guidance and support on managing, testing, containment, and mitigation of COVID-19 at long-term care facilities. Dr. Roberts has shared with me that there has been a comprehensive plan that's been developed by the Ohio Department of Medicaid and the Ohio Hospital Association for doing this work moving forward. If you listened to Governor DeWine yesterday, you know we've made great progress on all these fronts. We will be reopening the city slowly as we continue to monitor infections. Any business that is open, whether they have been open over the last several weeks or will reopen in the days to come, must follow stringent guidelines on social distancing, proper hygiene, cleaning, and face coverings for employees and customers. Let's go through the timeline. On May 1st, dentists and veterinarians can open elective medical procedures that don't require an overnight stay. Those can resume. On May 4th, construction, distribution, manufacturing, and general office environments can reopen or continue. On May 12th, consumer, retail, and other services can resume. But let me reiterate that these businesses can only reopen or resume only if they meet the stringent guidelines of safe distancing, proper hygiene, and facial coverings. I also want to remind everyone that the stay-at-home order remains in place. We strongly encourage all residents to only leave home when absolutely necessary, that restaurants and bars are not reopening for dine-in, and mass gatherings of more than 10 people are still prohibited. As we move forward in safely opening our community, we will continue to monitor the spread of COVID-19. We all have a role to play in keeping our community safe, and I ask all Columbus residents to do their part and act responsibly. I'd now like to ask Dr. Roberts to give us her latest updates and talk about why the 5 elements of our plan are so important to making sure we open safely here in the city. Dr. Roberts?
Thank you so much, Mayor Ginther, and good morning, everyone. Since before the first case of COVID-19 was identified here in Columbus, we have been working in tandem with Governor DeWine, Dr. Amy Acton from Ohio Department of Health, as well as with Mayor Ginther to protect the health and safety of everyone in our community from this virus. Thanks to their leadership, as well as the collaborative efforts of our community, especially all of you in the listening audience, of your resolve of all of our residents to practice the guidance, to stay at home and only go outside for those essential duties, to wash your hands, and really avoiding contact with other people. While we've seen the curve flatten over the last few days, this virus still remains a risk for our community. It's a highly infectious disease that we all need to be on guard for moving forward. We need to continue to be very vigilant and fight against it. Again, we must remain cautious while we're fighting against this virus. And as we've seen over the last few weeks, it didn't come to fruition the way it could have. And that's all due to the efforts of everyone in our community of practicing that social distancing, avoiding large gatherings, not having large gatherings, and only going out for essential duties. As a result of that, our hospitals did not see a surge in cases, whether it be to their ER or in their intensive care units, and we did not see widespread transmission in our community of COVID-19. But as the mayor said, in order for our community to reopen, there were 5 things that we really wanted to see from the state. And fortunately, we have seen many, if not all of those. We said we needed more testing and more swab kits. We needed clear guidance of how to handle mass gatherings. We needed some guidance of about face coverings or the wearing of masks. And we also needed some guidance and support of how we manage congregate living settings or long-term care facilities. We've seen in the last few days and even in the last few weeks that the state has come through with many, if not all, of those requests, and we appreciate that. Protecting our community is a multi-layered approach that comes from the state down to the city, and then we all work together to make sure that we're protecting each other. We have been consistent with the governor and Ohio Department of Health on the stay-at-home orders, as well as the gradual reopening of our state. That's a science-based and a data-based approach. We will continue to work in conjunction with them on this gradual reopening as outlined by the governor yesterday afternoon. During this time, Columbus Public Health will continue to do what it does best, which is to protect the health and safety of everyone in our community. It's the key role, and we're going to play a very key role in this response and reopening moving forward. I want to walk you through 3 things that Columbus Public Health will continue to do and will increase our efforts over the next few weeks as Ohio and Columbus reopens. First, we're going to continue with our case and contact investigation. And as the governor described yesterday, that contact investigation is going to be really critical for reopening Ohio. Right now, I have a team of disease investigators who contact every case that's been identified by a lab here in Columbus as well as in Worthington. We interview that case and we get as much information as we can from that individual about potential exposures and who they could have been exposed to, and we get a list from them of their contacts. My team then reaches out to those contacts, and for every case we usually have 4 to 6 contacts that they've been exposed to that we then need to quarantine and contact that person, ask them if they had any of the symptoms, and ask them to quarantine for the next 14 days to make sure that if they do develop those symptoms, they limit their exposure to others. That work will continue, and it will likely grow as we start to test more individuals in our community. And as individuals in our community go out and about and either go back to work or do some of their daily activities, those numbers will likely increase. The second that we're going to continue to do is surveillance. We look at ER reports, EMS runs about respiratory disease activity in our community. We also look at the sale of over-the-counter medications about respiratory diseases or fever-like illness. We will continue to do that, and we will continue to post our weekly report to our website that looks at the number of COVID-19 cases as well as what we call syndromic surveillance that we will share with the community. It will be valuable for us to monitor where we are in this outbreak and if we're seeing a decrease not only in our cases but our syndromic surveillance activity. And third, we will continue to conduct business inspections to ensure social distancing is followed. That's going to be critical moving forward as more businesses start to open in our community. We want to make sure that the employees working there are safe, but any individuals that come in for business are also safe. And thus far, we've conducted 495 joint inspections with Columbus Police and 112 compliance checks for licensed facilities. And we've issued 29 warnings to date. We anticipate, again, as business starts to reopen, we're going to see more of a need for these type of inspections as well as education in our community. So I just want to reemphasize how important it is for us to have this collective response to the COVID-19 outbreak. It's not just Columbus Public Health. It's not just the mayor and our elected officials. It's all of us coming together, working together to protect ourselves, to protect our loved ones, and to protect our community. So as we start to reopen Columbus, I would encourage you to continue to follow the stay-at-home orders when you can. Only go out when necessary. If that means you have to go out to go to work, do that and come back home. Go out for your essential duties. And when you do go out, you should wear a face covering. Again, it's protecting others around you so that you don't spread this virus, because we know there is asymptomatic spread. And to keep the gatherings, the family gatherings, just to those that live in your household, and not participate in any extracurricular activities at this time. So I thank you for all that you have done thus far to help our community get to where it is today, and I encourage you to continue to help us do that moving forward. Thank you so much.
Thank you, Dr. Roberts. And before we move to questions from the press, I just think it's important for us to walk through why these elements are so important. These are important steps for us as public officials, public health leaders to take, but also for the public. That testing and contact investigations or tracing that you talked about. Talk about why that is so important until we have a vaccine, and then maybe talk a little bit. I know I've got a homemade face covering here with me of my daughter's beloved Ohio Bobcat mascot. But why these are important, because I still think we have to do an awful lot of education around these face coverings, why they matter, how we can protect our employees and shoppers as the economy starts to slowly reopen. But testing, contact investigations, tracing, and why these face coverings matter.
Sure. So thank you for asking that question, Mayor, and I'd be happy to talk about case and contact investigation. And as the governor said yesterday, this has been the foundation of public health. We do case and contact investigation for a lot of diseases. So we're very familiar with this. And it's important because it allows us to contain and prevent the spread of the disease as quickly as possible. One, by identifying the case with more testing, as you described. The more people we can test, the more cases we can identify. Once we identify that case, we isolate that individual. Isolation is for ill individuals. We tell that person they need to stay home until their symptoms resolve, and then once their symptoms resolve, they usually need to wait another 3 days or more before they can go out and interact with the general public or even with their family and household contacts. Then once we get the list of contacts they've had, so individuals who they could have exposed while they were sick or even before they were sick, we know that individuals can shed this virus up to 48 hours before they develop symptoms. So when we interview the case, we ask them, who were you exposed to 48 hours before your first symptom? We get a list of those individuals, and then we contact them and we ask them to quarantine themselves for 14 days. That again is another layer of protection for our community, because we're now removing those individuals who could be spreading the virus. We remove them from our community so they're not spreading it to others. It's a very efficient and effective way of reducing the spread in our community, and we will continue to do that moving forward. But the first step in all of this is the testing, to identify the case. Once we identify the case, then we can identify the contacts and exclude them from interacting in our community. You bring up the face mask, and the face mask, although I know they're intrusive, they're not comfortable for many people, they're very, very effective in the spread of this virus. And as we continue to try to reopen Ohio, we need to do whatever we can as we're going about those essential duties, whether it be work, grocery store, or doctor's office, to reduce the spread of this virus. As I said, people can shed the virus up to 48 hours before they even develop symptoms. In addition to that, some individuals can be what we call asymptomatic carriers of the virus. They could have the virus, never ever have any symptoms, but yet they're shedding the virus and could share it with other people. So by myself wearing the face mask, I'm preventing the spread of the virus in case I'm one of those asymptomatic carriers. And if I'm wearing it around the mayor, if the mayor is wearing a mask, in addition to me wearing a mask, that is a barrier for him so that he cannot get the virus that I could be shedding. So it's important for both of us to wear a mask. Me as potentially the asymptomatic carrier, so I don't shed the virus, and then the mayor as a healthy individual, so he doesn't get the virus. So again, it's very, very effective. And it's important for everyone to wear a mask when they're around other individuals, especially when they can't guarantee that 6 feet of distance between them and the other person.
Thank you, Dr. Roberts. These face coverings are just so important. I think we have a lot of work to do in educating the public and having them understand the value of this. Obviously, you can make these at home if you're able, and we'll provide additional resources on where folks might be able to access these face coverings and masks and give some guidelines on making those. We'll make sure to share that through the city's website or through CPH. And I want to thank Kroger for stepping up and requiring this even before the governor's announcement yesterday, because they want to make sure that the health and safety of their employees and their customers remain a top priority, and want to encourage other business leaders in this community to step up and follow Kroger's lead.
And that's Mayor Andrew Ginther and the Columbus Health Commissioner, Dr. Mysheika Roberts, talking about how Columbus will be reopening for business. Thanks so much for joining us today.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.
I'm Andrew Saul, Commissioner of Social Security. Beware of threatening calls from telephone scammers pretending to be government employees. These calls are not from us. Hang up and report the call at oig.ssa.gov.